Good morning, good afternoon. Hello, everybody. Welcome back to our series on retention planning and strategy, the behavioral health edition. My name is Suzanne Spear. I'm the Director of Workforce Development at ACU, and we are excited to have you back here for week 3 out of this 6-week series. And today, speaking for us is our faculty member, Ann Hogan, and we are excited to hear what she has to talk to us today about integrating your behavioral health staff into your overall health center there. So I'm going to let her take it away. Thanks so much, Ann.
Thank you, Suzanne. So the Association of the Clinicians for Underserved, and Suzanne certainly chime in at this point if you need to, they focus on recruitment and retention and work a lot with the National Service Corps. They have resources, training like this, and a whole lot of networking opportunities. So if you don't get their emails and all their newsletters and things like that, be sure to sign up at achcworkforce.org for all that information. And then they are part of also a national cooperative agreement, the Association of the Clinicians for the Underserved, and Community Health Center, Inc., which is in Connecticut. So between the two organizations, they do have a number of national cooperative agreements. This one is focused on recruitment and retention, and CHC Inc. Is pipeline and team-based care. So anyway, if you be sure to like both those organizations on everything, and you'll get a lot of information on what all is going on and the exciting work that everyone's doing there. And then the STAR Center, which is the Solutions, Training, and Assistance for Recruitment and Retention. So that's the 2 in STAR, chcworkforce.org. Be sure to go and check out all the resources that we have there on the site. And when you go to the discussion boards and things like that, kind of play around also with resources, the resources tab, and you can actually find retention resources, recruitment resources, etc., down at the very lower bottom part of the screen there. So be sure that you're actually using that to the nth degree. And our faculty is Allison, Mariah, myself, and Suzanne, and all of us are willing to answer any questions that you might have. Mariah does a lot of the back end, all the support information, gets all this together. So if you're having technical difficulties, she's probably the one to email. But if you have any content questions or things like that, be sure to email any of us. Allison, Ann, and Suzanne are probably the ones that will answer that. But Mariah will certainly fend that if she gets that email. So make sure that you do that. The webinar housekeeping today is, of course, we're recording. Ask any questions that you have and have fun. We do have some time at the end for questions. So when you have questions, raise your hand. Use the chat in the question boxes, which is over here. I don't know if you can see my little mouse going around here. And then email Mariah Blake also if you need to. So at any time. So we're going to talk about behavioral health staff and integrating them into your care model today, or transitioning them into your health center. So that's what we're going to talk about today. And as always, there's a plan, and then there's a strategy, which equals retention. And that's how you move forward. So that is what we're going to talk about today. Now, when we talk about behavioral health staff, I don't want to have to run through every single title for any of the providers, because there's so many that encompass all the providers, right? So when I talk about behavioral health staff today, we're talking about psychologists, psychiatrists, nurse practitioners, licensed professional counselors, substance abuse counselors, clinical social workers, and all sorts of other people. So we've kind of lumped it all together to just make it easy when it comes to integrating them into your center. Now, the goals of the Academy are participate in the discussion board, connect with each other. Yes?
I am so sorry. We are not seeing the current slide. So we are a few slides back. We're in slide 5, so if you wouldn't mind, I am unable to advance. I'm still seeing.
I'm on 12. Let's see. They're doing it great on mine. Let's see. I don't know.
All right, and if you wouldn't mind letting Suzanne take mouse control back, and she can try advancing. Is that working?
Is this working now?
Yes, we're caught up with you.
Yeah, perfect. Thank you so much, everybody, for bearing with us with our technical difficulties. Yes,
somehow, I don't know what happened, but yeah, so we have, now that you didn't see the other things, I'm just going to show you one. I'm going to go back and show you one, which is this. All the behavioral health staff, as you heard me say, we're going to lump everybody together, which is not necessarily fair, but that's what we're going to do because we just need to do that to get clear, unless we're being very targeted on, say, a licensed professional counselor. Now, the goals are the discussion board and also webinars for the Academy. And so you participate in the discussion board is always a good thing to do. We do hope that you're utilizing that to connect with others, to share ideas, to share your challenges. Other people may have questions or answers that we can't answer, but they can certainly chime in and help you with. Obviously, you're out there doing the work, and you actually have the answers better than anyone else on here. And then webinars. Not only is this the webinar that you're doing right now with the Retention Academy, there are a number of webinars that are there on chcworkforce.org that you can take advantage of. Now, the goals is to take your retention plan to the next level, focus on specific strategies, and connect you with others. So please go ahead and do that. Like each other on LinkedIn or connect with each other on LinkedIn. If you have other health centers that are on Facebook, be sure to connect to those also so you can see what others are doing. Now, we have the first 2 weeks. We've done a lot of work on the planning process, the data gathering of HR and organizational data, your PDSA cycle, everyone loves those, don't they? And then the design, the retention plan, identifying the elements of a retention plan, and then exploring all of this information. So when we think about that, that's kind of been the last 2 weeks. You can always go back and look at those webinars and see what you've missed if you weren't able to join in. Now today, we're going to talk about considering integrated care. So some of you may be considering integrated care. Hopefully, most of you have some version of integrated care. And then we're also going to talk about crossing the cultural bridge between medical and behavioral health. As we know, it's quite a bridge sometimes to cross because sometimes we do separate into medical and behavioral health instead of lumping it all together as a person's health. And so, and we certainly have, there's lines that medical and behavioral health staff don't necessarily cross, but we need to get them to work together when it comes to the patient. And most of them always are willing to do that when it comes to patient care. So we're going to talk about considering integrated health as our first section. And the reason to do that is all of these benefits based on NCQA. They did research on PCMH. And so when we look at this, it should not surprise any of us as to what it says here about why are there benefits to integrated care and to an integrated team model. And so when you think about it, improve patient experience. It's obviously that we're taking care of the whole person when we also include behavioral health into their ability to be seen with behavioral health also. Reduce clinician burnout. Clinician burnout, and then my next slide shows some stats, is just staggering. And it's not only family practice docs, it's not only specialists, it's kind of everyone. Everyone is getting really burned out with all the needs and all the pressure. And we obviously have a shortage of providers, and we have more patients than we can actually see. So again, it becomes, we need to be very conscientious about how we see patients, what services we're able to provide to them, and how we can give them the highest quality of care while we have them in front of us. And then also, obviously, it reduces hospitalization rates, reduces ER visits, increases savings per patient, higher quality of care. Of course, that's what we're all after, along with improving the patient experience. And then it also, we're having technical difficulties today. Also, obviously reduces any costs that we have. So those are all really important reasons that we want to provide comprehensive care for all of our patients. Now, the studies show, and that's supposed to be a flame because it's really a crisis here. And the Canadian Medical Association studied, and they did 15,000 doctors in the United States, which is interesting, the Canadian Medical Association. 42% of the physicians reported feeling burned out. And the highest rates of burnout reported by specialties of critical care and neurology and family medicine. And most of our providers in the community health center world are really family medicine providers. You may have some specialty, you may have some OBGYNs, you may have internal medicine, things like that, but typically they're in family medicine and seeing families and helping those things there, people there. So also a team-based model of care helps reduces burnout because it affords physicians the time they need to listen, think deeply, and develop relationships with patients according to the AMA. And this is why it's so important that we don't only need to do team-based care for the physicians, we need to do it for the patients. But it benefits everyone involved, right? We've all had situations where people are just, even our patients are burned out, right? They may be burned out from work, they may be burned out from finances, they may be burned out from a home situation, etc. And so by the time we get everyone together, we don't want everyone on the whole team, including the patient, the physician, the behavioral health provider, and the support staff all burned out, right? And so we need to find a way to make sure that they can all work at their highest level and at the same time achieve some satisfaction and knowing that they did what they could do for that particular patient. Now, we do have a poll question. And Mariah, can you run the poll?
All right. So I've just opened the poll there. If everybody could chime in. We'll leave it open for a couple more seconds.
So, do you have a team-based care that includes behavioral health and dental? Yes, no, or in the process of doing this? And even if you just want to put your answers just in the chat box, that would be great too.
All right, all results are in. We're saying 67% reported yes, and 33% reported in the process of doing this. So nobody said no.
Oh, good. That is fabulous. And so it is that team-based care that we want. We want it at 100%, and I'm glad that we have 33% in the process of doing team-based care. That is very, very, very important. Now, we talk about the team-based care and who actually makes up the team. And that is a big portion as we talk about trying to integrate people into our systems, into a system that's been in place usually for a number of years. Community health centers have been around a long time, and we typically don't change easily, right? And so we need to get everyone on board when we start integrating other providers and the way that we see patients. So who actually is on the team? Your team should include at least clinicians, your clinician support staff, even administrative support staff. It might be a registration staff, but your team needs to be comprehensive as far as who's actually included in that behavioral health integration team. And when you think about that, it's important because it affects everyone, because you're going to change the way that you actually see patients. and how that patient is actually brought into the behavioral health care model. Or say you're integrating dental care into your system also. So you might have kind of these three sections. And depending on if you're larger than that, you may have other services that you need to bring into that team. It may be housing services, it might be transportation services, it might be all the services that you have for a food bank. So it could be a number of different things. Now they're not necessarily your care team, but they're all part of your support team for that patient. But your care team has to have all of the clinicians that will be involved in that patient's care on that team, including, again, the clinical support team, and it also the support team that's maybe has a more of an administrative role. And make sure that that's kind of who is actually seeing that patient. And then, why are they part of the team? Make sure that everyone understands why each person, and each person should not just be assigned a team because that's a nice thing to do, right? They each have a role and a function on that team. So how is it, why are they there? And how does the team function? And so when we talk about how the team functions, so who sees the patient first? What is their role? What is the questions that they ask of the patient? Who collects the information? Who enters it into the EMR? How does that get shared? How do you find out that a patient is done with this and now needs to go see the behavioral health provider? How does that actually work? And so you need to decide who has that warm handoff, who actually takes the lead in getting that warm handoff for that patient. So how does the team actually function? And when you look at a number of organizations, say it's kind of a logistic area. So if you fly or something like that, there's a team member that actually checks you in, right? Once you purchase your ticket, there's somebody who loads your luggage, etc. Think about it outside of our health center world in the logistics that it takes to get from point A to point B, and really start looking at that cycle for that patient and how each team member functions within each section of that. And then what is their role? When it comes to the role of team members, we need to look at, are they working at the top of their competency or license level, right? We need to be very efficient with our resources. We don't have enough resources to go around in this case, but we need to make sure that we do what we can. So again, having people work at their top of their license. If they're not a licensed professional or they don't have a license, maybe it's not an RN, maybe you're talking about a medical assistant that's certified. How are they working at the top of their competency level? Do they have standing orders already in place within your health center that they can function within, so that we can be most efficient with providing this team-based care? And of course, patient panels can be very integral in this, because it assigns basically the patient to the providers or to the team itself, and that team is responsible then for that patient's care. Now, when you talk about the actual team, think about who really makes it up. When you think about how many medical providers make up on that team, how many behavioral health providers can you put on that team? How many support staff? So what actually does the team be made up of? Now, medical providers, for your physicians, you probably don't have as many physicians as you have for physician assistants or nurse practitioners. Can one of them lead the team? And when you think about that, think about, just because there's a shortage everywhere for patient care. Is it appropriate that you have dental providers on your team, your dental hygienist or your dentist? And could they possibly lead the team? They may or may not be able to do that. It may be medical's responsibility to do that. But then you have the behavioral health providers. Now, again, there's a shortage of behavioral health providers too. It's tough to find them too. So when you think about how are you going to make up this team, is there a number formula that you're looking for per patient panels, or how are you actually determining how that team is formed? And so think about how you're going to prioritize those different providers for different maybe demographics of your health center. So, and how that actually fits together. But really take some time and sit down and figure out who is on that team. Now the why that you want this team together is obviously patient care and quality of care. It provides much better quality of care to our patients when they actually have an integrated team model versus them coming in for immunizations and we forget to check their teeth, or we forget to ask mom or dad that's there how they're handling being a new parent. Are they having any struggles with that? Is someone having feelings of depression, etc.? That's the reason why. It has to do with the patient care and the quality of care. Now, the other results of that is we can decrease burnout. We can retain staff because they're much more satisfied with the way that the patients are being handled. And we also retain our patients. And of course, when we start asking patients questions and we start asking, finding out more information about our patients, we connect with them. And that forms that relationship that we all want, and it breeds to retention of our patients. Now, when we talk about the roles on the team, defining the roles, who is actually in charge of the team? Usually that is a physician or a medical provider, but it doesn't have to be. So think about who is it when decisions get tough within your team, and you have to, because again, it's about integrating people together. And if you don't have that team format, you're not going to be able to get it. It's one thing to say, okay, you're all going to work together, but again, these are the things that will actually make your team function. Is how will the decisions be made as a team? How will you solicit each person's input? Or maybe that medical assistant heard something as they were walking the patient back that the patient's in a domestic violence situation. How is that medical assistant going to get that information to the medical provider or to the behavioral health provider so that those things can be addressed? It may not be their role to actually talk with the patient about that, but they now have information that they need to share possibly with that medical provider or the behavioral health provider so that that can at least be addressed during that visit. So again, how are decisions going to be made? How are things going to be communicated? And ultimately, who is in charge? Because at the end of the day, you need someone to make that decision about this patient care and how this is going to be given, right? And how many times we can have the behavioral health provider come in, because again, we have limited resources. So how else can we give that person care? What resources can we provide for them, etc. At the end of the day, you need to have someone in charge of that. And then the communication piece is huge, because you are trying to integrate people together. And the worst thing you can do is say, I have a team, but we all work in silos, right? And the only way you can break down those silos is through communication. Now, when we talk about functioning as a team, and this is not forming the team, this is once the team is actually functioning, it's a really good idea to read Patrick Lencioni's book, The 5 Behaviors of a Cohesive Team. And he talks about these 5 behaviors and why it's so important that for a team, you have these things. And the first one, and the foundation of any team, will be the trust of the team. So the team needs to be able to trust each other and believe that they know, like, and trust. We'll talk about that a little bit later. But talk about, they have to trust each other. The medical assistant has to trust the physician. The physician has to trust the medical assistant. Both have to trust the behavioral health provider. Behavioral health provider needs to trust both of them, right? It has to be a whole team. And if you don't have trust between the team, you won't actually have a team that's very functioning. And then the team needs to be held accountable on how they're going to actually deal with conflict. Because it's not always going to be easy when you're in a health center and you have more patients than you can actually handle during that day, and you have very difficult cases, etc. Conflict does arise, and we need to recognize that. And then how the team is committed to each other. What kind of accountability does the team have? And we'll talk a minute about data and why it's important that you actually let them know what it is they're responsible for in accountability, and then what are actually their results. Are they making an impact in that patient care by having an integrated team, and how is that really impacting the patients? And that's important because we all feel better when we know that we've had positive results. And most often when you have an integrated team, you do have more positive results than you would have gotten if you were just working in a silo. But we cannot ignore the fact that some of you have clinic layouts that make it difficult sometimes to have this team-based care. And so we want to think about when you actually have your clinic, do you have people in offices? Or, and are your offices, including exam rooms? So you might have a provider office, you might have an exam room, you might have a behavioral health area within your clinic that might be in an office. But is it too much when it comes to patient movement and patient flow for them to be expected to move to each office? Because remember, each time you move that patient, it's an opportunity for them to say, you know what, I think I need to leave for the day. I think I can't stay any longer, right? But if you have them in one room, for instance, then the patient is more likely to stay through their medical appointment, through their behavioral health appointment, or at least someone to come visit and talk with them. If you can do that all in the same room, it doesn't really allow them to feel like they have a break in their service and they can leave also. I mean, I'm not saying like keep the patient captive, I mean, search the imagination, but you know what I mean. I mean, it's one of those things where you want to have everybody come to the patient. You don't want the patient constantly moving. And then when it comes to the layout, a lot of people, including the CHC Inc., who's done a lot of studies on clinic layout, they have pods for all of their care providers, for the entire support staff that supports that particular panel. And so that pod is really an open air area where people work from. And it doesn't matter if you're the physician, you're the medical assistant, you're the behavioral health provider, you're the person, the administrative support staff for that team, whatever that is, they all work in an open area together. So they're constantly in communication about patients and about how their flow is going to go that day. Additionally, we've all heard about huddles, and it's true, huddles work. When you look at who's coming in that day, or if you do it the night before and huddle about who is going to come in the next day, and how do we effectively and efficiently integrate the care team for that particular patient, oftentimes you can make it much more efficient. If they're coming in for a wellness visit and they need immunizations, can you give a standing order to the medical assistant to go ahead and do that if they meet those parameters? If they've seen behavioral health last time, or if they still need to see behavioral health, make sure that the behavioral health provider knows that this patient is coming in, say, at 10 o'clock, and that I'll be coming to get you at 10:10, or somehow I'll ring you to come to this patient's room, probably about 10:10. So please be available at that time, because we really need to connect the two of you. And it's really important that when you are talking about integrated behavioral health especially, it's one of those services that people need to know their provider. They're more than likely, just based on the way we do things, if we're told to call a behavioral health provider and make an appointment with them, the likelihood of that happening is probably far less than if you actually have the behavioral health provider walk into the patient's room and introduce themselves and actually get to know that patient a little bit. That can really help your success. And again, limit the patient movement throughout your clinic layout. So think about how your clinic is actually laid out. So for those of you that have redesigned your clinic layout to enhance patient visits, let's think about this, and also put in the poll or answer it as a question or a chat. Have you redesigned your clinic layout or patient flow to enhance the patient visit? Yes, no, or we're considering it, but we haven't implemented anything yet. And it's tough. It's tough to figure that out sometimes, as to how you can do it. So we'll give it just a few more seconds for this poll.
All right, looks like we're split 50-50 between yes and we're considering it, but haven't implemented anything yet.
Oh, well, we are 100% that we do not have any no's today. So that is the good thing. Out of the 2 poll questions, no one has answered no. But again, how do you redesign your clinic layout? You know, really, it's about mapping that patient experience. So try to pretend you're a patient and actually go through that process, because sometimes it can look really good on paper, but it doesn't actually work. And that's when it comes into including your team in those decisions, because they're the ones that actually are working the floor and doing those things. Now, when you have the integrated care model, there is a bridge that needs to be crossed sometimes between medical and behavioral health, because both are important. Both recognize the need for each other, but it can be a tough thing to try to figure out how this actually gets integrated and works. So we're going to talk about some of the things that are problems are the patient barriers. And then also there's our own internal barriers of doing things the same way we always have done, or just saying, you know what, as of tomorrow, we're going to do integrated care. And it takes a little more planning than that to actually make it successful. So we're going to talk about some of the things, and we certainly won't hit all of them, but it's certainly a lot of things that you need to take into consideration. So your patient barriers. Oftentimes, patient barriers when it comes to integrating behavioral health are communication issues. So it may be the language barriers. It may be the barrier of even calling it behavioral health. We've even gotten away from mental health for various reasons, for good reasons. But we're calling it behavioral health. So think about how that communication can be done so that the stigma that's on patients and just our culture in general, right? There's a stigma towards receiving behavioral and mental health care that we need to break down. And so how can you communicate it to someone that you want to have a conversation with someone who may be able to help with some of the challenges that they have in their life, and maybe not call it necessarily behavioral or mental health. But additionally, you need to have someone, again, that they can actually communicate with and relate to. And so make sure that you're always providing these services as best you can. And I know some of you struggle with many, many different languages at your health center. But the more people that you can have that speak the native language of the patient, the better off you will be in your communication. Cultural differences. There's obviously cultural differences with people receiving behavioral health care. Some cultures are a little more open to that than other cultures. And oftentimes people just feel like the culture says we should just be able to handle it ourselves, right? Or we don't share that information with others. And that's something that we need to break down in everyone's culture, right? And those can be some of the hardest barriers that you're going to break down, are those cultural differences. And then the economic challenges of receiving care, whether it be medical care, behavioral health care, dental care. Again, people only have so much money to go around. And so again, they're going to start prioritizing and deciding what's most important for them. And so you always have those economic challenges when it comes to the barriers on a patient getting seen. And then you have the trust issue. Now, this is a little bit different when it comes to patient barriers, because when you talk about medical care, you obviously have the trust issue also. But for the most part, and I'm making a generalization, but for the most part, people realize that you need to go to the doctor, right? You need to go for certain things and get checked up, or you need to get vaccines for your kids, etc. But when it comes to the integration of that behavioral health, it's truly a trust issue with, I'm telling someone now very personal things, and I need to know that it's only between the two of us, that I trust that that's where it's only going to be. And that's really important, in that can be a real barrier. And so how you can get around that is, we'll talk about just developing that relationship again with the patients, and within your team also, so that your other providers can talk to the patient about the great services that we provide in behavioral health. But they're only going to do that too if they trust that provider too. Now, quality of patient care. When we talk about quality, that we want as our main target. And so this is supposed to be a target here, right? Our quality patient care. But kind of that outlying one is, that's our overall goal, but we need to figure out how we actually get it to work, right? So what does it actually look like? How do we make quality patient care happen? That's that green section. And then what needs to improve is the blue. So when you think about the quality of patient care, how do you actually do that? And it's more than just saying this is what we do. It's actually what does it look like? And how does that team get formed? Why do we put people on the team that are on the team? How do we look at what needs to be improved? How are we continually assessing what needs to be improved in order to make the patient care happen within an integrated team? Now, some of our other internal barriers when we talk about integrated care, and again, most likely people will be all for integrated care. They think it's a great idea. But when you actually start to implement it, you can run into struggles, because you have, again, a team working together. And there are very, very, very successful teams, and there are extremely dysfunctional teams. And so just to say we're going to work as a team is not enough. And so the important part from the organization is to let them in on why and what is needed, why this is needed for the organization. So what is needed and why this is needed. And it's really important. And it needs to be focused, again, on providing patients the best care we can. Let people feel like they're included in the decision-making about how the patient flow is going to work. How are we going to adjust our EMR so that we can see when a patient is done and it's now my turn to enter the room? How are we going to communicate this? And again, don't dictate to them how that's going to necessarily happen. There's times that you will, but again, let them be included in that decision-making process. How do they see the best way for this patient to come into the clinic and receive care in an integrated model? Because it does change the way that they've typically worked, right? They've typically worked, the medical assistant might go into the room, or the nurse might go into the room, do certain things, the provider, the medical provider comes in, then there might be one more person that comes in, maybe for billing purposes, or it might be a medical assistant again, or they might be done and asked to leave. Now we're adding a whole nother care provider to that team. Now it may be the medical provider and then the behavioral health provider. It might be the behavioral health provider first, or a dental provider, etc. So make sure that they're included in that decision and they have a say as to how this will work best for everybody. Let them know the expectations. The expectation is that we are going to actually provide integrated care because it's the best thing for our patients. Now, how will we do that so it benefits everyone? And so, again, include everybody, because otherwise you will hit into internal barriers in actually getting this done, even though everyone will probably agree it's a great idea. It's the actual logistics of making it happen where you need to help people out. Now, when it comes to that, when you assess, is it actually working? What is happening? You want to be sure you're collecting your data. Again, how many behavioral health patients did we see last year? How many need to be seen? How many received services from us? How many people did we impact, right? And what was our target? How close did we come with what we said we were going to do? And be sure that when you're assessing that and collecting all that information, you're providing it back to the team so they can actually see the results of how they've worked together. Or they can see that maybe they're missing the mark on a section in that data and what you've collected, and they can come up with a solution as to how they can do that better. And again, this helps with not only retention of staff, recruitment of staff, lowers the burnout to have an integrated care team. It helps in so many different ways. So make sure you're constantly assessing it, collecting the data, figuring out how many people you impacted. Are you hitting your goals? If not, you reassess and you go back to your data, go back to your team, and again, get to those goals or revise those goals if they're totally not going to meet the mark. But make sure you're constantly communicating with people, because that's probably the biggest part about making this team and this change happen within your organization. Now, just to review the different areas, again, why have an integrated care team? These are all the reasons. They're huge. The number one reason, though, that we're talking about today is to reduce your clinician burnout, because we want retention. And obviously, the most important thing there is the higher quality of care for improved patient experience. And if the other things certainly help the bottom line, don't they? So we need those other things also. But again, we're talking about reducing the clinician burnout and retention of staff. Now, the other thing that you want to review is, again, who's in charge of your team and why it's so important to have a leader on that team. Who is your true cheerleader for that team? And who is going to really cheer you on and get that team motivated to really see the number of patients they need to see and make the changes they need to make to provide an integrated care model. And then, again, how will the decisions be made as a team? How much input do people have? Think about that. It's really important to figure out how will the decisions be made. And then the communication. Communication is crucial. You need to be able to communicate with everybody around. And how do you actually provide that communication? Again, is it through email? Is it through different apps on the phone? How are you letting people know that this patient is ready, or that this patient's coming in today, or these are the type of services we're offering now? All different things. So the communication is key. And then think about those 5 actual behaviors of a cohesive team, meaning trust, conflict, commitment, accountability, and results. If you haven't read the book by Patrick Lencioni, I would highly recommend that you do. It's called The 5 Behaviors of a Cohesive Team. And that can be a real important piece as you move forward to be able to do that. Now, overcoming barriers. Think about all your patient barriers that you have already, and how in your internal barriers can you get rid of those so that you can impact the patient the most. And part of that is not moving the patient a ton. Patient movement allows there to be a break, right? So as much as you don't have to move the patient, your internal barriers can also be, do you have everybody separated in their silos or in their offices? Can you go more towards the pod concept? Can you also provide kind of communication methods with them? Whatever team training you can provide to help them communicate. It's really unfortunate when you just have a team that may be really good individuals in how they work. Say you have 5 or 7 employees that are fantastic. One's a medical provider, one's a behavioral health provider, a dental hygienist, a medical assistant, RN, and a administrative support person. You could have all these people that could be wonderful at their job, but when you actually put them all together and need them to work together, they don't necessarily have the skills to know how to do it. And you can save yourself a lot of time if you actually teach them how to be functioning as a team. So it's really important that you don't get in your own way when you have those internal barriers, but be sure you're helping people through that process. Now with that, does anyone have any questions? We have a few minutes left to answer questions.
All right, and as we mentioned at the top of the hour here, you can pop your questions into the chat box in your go-to control panel to the right of your screen, and there should also be a questions box there. Either way works fine, or just raise your hand and we'll chat out to you and see if we can connect you with the right information.
And I will just say there's a couple resources, actually. If you go to the chcworkforce.org website, if you go to resources, there's a lot on physician burnout and also on retention. So make sure you are visiting those, and then pop your questions also that you have on the discussion board, and so that we can actually do that. Is there any questions yet so far? Otherwise, we'll just keep going here.
We haven't had any questions come in just yet, but we have plenty of time left if anybody has them. Just feel free to pop them in, but go ahead, Anne.
Okay. And then, so the discussion board, make sure you're selecting the retention planning strategy group. Comment and reply to anyone else that is there. And so make sure you're doing that. And then if you need something, the resource center, actually right down here at the bottom, there's a resource center. And if you click on that, I'm telling you, they have bundled resources, they have toolkits, et cetera, so be sure to look into that also. And if you want any more information on integrated care or the different models, because there's a whole lot of information that you can talk about on integrated care, and there's a lot of information that different health centers, the National Institutes of Health, all sorts of people have collected on PCMH and on integrated care models. So, you know, just ask around and we can find you any information you need on the model itself. Now, this week for the discussion board questions, there are 2 questions. What are the barriers you face in integrating behavioral health into your center? Or if you've had great success with that, please let us know what those successes are. And then, how has an integrated care model benefited your retention rate of your staff? We know it benefits our patients, but how has it benefited the retention rate of your staff or the satisfaction of your staff? Now, before we leave, I know Suzanne has a few more things to say, but right before that, we'll answer questions on the discussion board. Our next webinar is November 28th at 3 p.m. Suzanne, do you have some things to add?
Yes, absolutely, Anne. Thank you so much. That was a fantastic, just fantastic discussion about integrated care and the importance of planning for integrated care. And as we think about, you know, specifically working with behavioral health providers, it just was a great overview, and thank you so much for that. I did want to mention that, you know, we've spent 3 weeks on retention planning and all the things that we should be considering when it comes to the data behind retention planning, the components of a retention plan, and actually how to plan for integrated care as a means to, as a part of your retention plan. As Anne mentioned, our next webinar is November 28th, so we have a week off. Obviously, next week is Thanksgiving week, and so folks will be getting their turkeys thawed and ready to go. So we're going to take next week off. But the last 3 weeks of our time together, we are going to be having some guest speakers. So from various organizations about different retention strategies that you can put in place at your health center. You don't want to miss these 3 sessions. I think you'll find them very useful and helpful to what you guys are doing there every day. And we're going to be sending out some information about all of our guest speakers on those sessions. So again, take a look out for that information and plan to join us on November 28th. And in the meantime, we will see you on the discussion board. And don't forget to log in there. And again, if you have any questions or things come up that you think about as a result of any one of the first 3 presentations, please don't hesitate to call us or email us, and we would be more than happy to get your questions answered. And with that, I think we are done for the day. Thank you guys again for joining us, and have a great Thanksgiving, and we will talk to you on the 28th. Take care, everybody.